Now, some of the elements of the antimicrobial stewardship program, the team, once they've identified lapses and deficiencies in the appropriate use of antibiotics, they will try to educate the teams or the prescribers. And there are three major elements that have been identified some time ago by the IDSA. And the first four is to say no to antibiotics. When do we say no to antibiotics? We say no when we're not treating an infection. So a patient who has no signs or symptoms of an infection, no fever, no pus, no wound, no redness, no erythema, you need to say no for that specific antibiotic. When you're treating a colonization or a contamination and you're not treating a true infection. After evaluating the prescription for 48 hours and you find that there was no rationale behind giving an antibiotic, you need to stop it. And then stopping the antibiotics in general when not needed. Now, we use the antibiotics wisely, meaning we choose initial treatment well, based on experience and based on the clinical presentation of the patient, and also switching from a parental antimicrobial agent to an oral agent when necessary. The last part is the summary of the prevention or the healthcare-associated infections from elements other than the antibiotics, which is limiting devices. So patients who do not need a bladder catheter, the catheter should be removed. A central venous line that is no longer needed should be removed, because you need to remember, every single invasive device that exists in the patient for an extra day is always a risk for leading to an infection. There needs to be, as we mentioned before, respect for infection control measures, and we need to vaccinate our patients when these vaccinations are available, specifically the pneumococcal vaccines to prevent pneumonias and the meningococcal vaccine and others.